All hands on deck. That's the call from the business body, Business for South Africa. It has partnered with government to ramp up the vaccine rollout program, which has widely been criticized for being too slow in the country. About 1 million healthcare workers were supposed to have been vaccinated by now under phase 1 of the program. But only 291,000 have been vaccinated thus far. Now there is a plan to fast-track the process to complete phase 1 in the next 3 weeks before phase 2 kicks off on the 11th of May.
We think that this is a critical moment in the implementation of the vaccination rollout strategy. It's a necessary precursor to phase 2, that we can launch the EVDS, which is actually just been launched now at 4 o'clock. For the over 60s, they're the most vulnerable, the most at risk. We hope we can vaccinate them, and we believe that we've got the capabilities as a country, the National Department of Health, supported by the private sector, to achieve that in the next 2 or 3 months, and indeed to ramp up to over 250,000 vaccinations a day thereafter. That, of course, requires collaboration between all businesses, our social partners in the form of civil society, labour, and, of course, our lead partners in government.
16.5 million South Africans have been targeted for vaccination under phase 2. Companies are being urged to register their premises as vaccination sites for their employees and other members of the public.
That's absolutely essential. We think that the private sector can, in fact, giving its facilities to make them available, not just workplace locations, but also, obviously, the health facilities, so pharmacists, clinics, private hospitals, little and mass vaccination sites. We think that we can vaccinate up to 165,000 people a day, but that is indeed dependent on people making their facilities that are appropriate available with the necessary support mechanisms in place.
Business for South Africa says people should not fear getting vaccinated, despite the suspension of the Johnson & Johnson vaccine, which is linked to blood clots in some people abroad.
We're very aware of the potential side effects, but our position as Business for South Africa is that the risk that is being run by any such side effect is in fact far less than the risk indeed of blood clots from COVID-19 itself and from many other things that can cause blood clots. So we are encouraging everybody in the adult population to get vaccinated as quickly as possible.
No one in South Africa will pay for getting a vaccine. Those with medical aid will be fully covered by their schemes. Bongeni Muchwa, SABC News, Johannesburg.